Osteoarthritis is the most common type of arthritis, affecting about 32 million Americans. It happens when the cartilage that cushions bones wears out over time. It often affects the knees, causing pain and stiffness. Marty Salt putting your family first tonight.
Knee arthritis can make every step a struggle, and it can sideline anyone, not just the elderly.
Patients are getting younger because we're simply more active. We're beating up our joints more, so we're getting earlier arthritis.
Repetitive stress, your genes, and carrying around extra weight can all contribute to the condition.
As the population has gotten a little heavier, we're seeing more and more knee arthritis.
Luckily, there are some ways to ease the pain and discomfort. In one large review of nearly 10,000 patients, researchers looked at 12 different non-drug therapies. They found that knee braces, hydrotherapy, and exercise were the most effective for knee osteoarthritis.
Now we have people who want to be active, don't want to take medications, and now have earlier arthritis.
Another review of 200 studies showed that aerobic exercises like walking, cycling, or swimming offer the best pain relief and mobility improvement. And Korean researchers found that low-dose radiation therapy eased knee pain and improved movement in people with mild to moderate arthritis. And if these less invasive approaches don't work, surgery is a tried and true option.
Today's people want to do more things. They don't want to let their pain and disability slow them down.
With ways to help your knee pain, Marty Salt, WGEM News.
And surgery could include a simple procedure like cleaning out the joints, or more complex like replacing the knee with an artificial implant. Some other options for knee pain include a massage, acupuncture, hot or cold therapy, and of course, stretching.